Hello, everybody, and welcome to the Globiotics webinar today. Thank you all for taking time out of your day to join me. I hope everyone's doing well during this kind of new normal that we're trying to get used to. Today's topic is going to be hormonal skin conditions and how to treat them successfully. I will open the floor up afterward, or the computer, I should say, for questions and answers. So you'll be more than happy, or you're more than welcome to go ahead and type in your little chat box or your Q&A box questions as we go along, and I will answer them all afterward. My name is Dawn Clifford. I'm the Director of Global Education with Globiotics Skincare, and I'm here to help you out and answer any questions that you might have regarding any products or ingredients or protocols, customizing for specific skin conditions, and just to further your education. And today, and for the next few weeks is a perfect time for us to do this. Many of us had to close our facilities and have stopped working for a few weeks. And now is the time that we can catch up on all that learning that we've always wanted to do. So if you do have questions afterward, you can always email me. I'm really good at returning my emails either the same day or within 24 hours. My personal email is education@globiotics.com. And like I said, I will be happy to answer any questions that you have. In regards to placing an order, I can give you that email at the end of our session today. So we're going to start by just talking a little bit about the philosophy of Globiotics. For those of you who might be on the webinar that are new to Globiotics, welcome. And for those of you who are current accounts or current users of Globiotics, welcome to you also. So you might be more familiar with our philosophy. But as a pioneer of probiotic skincare, which we definitely are, Globiotics has been around for about 8 years now. So our philosophy is that we like to maintain the integrity of the skin while delivering results. Globiotics focuses on reducing inflammation and rebalancing the skin's ability to heal itself, giving you beautiful skin from the inside out. And that's really what we're all about, because there are so many inflammatory conditions that actually stem systemically from within our body that can actually give us symptoms on the surface of the skin. That's what our skincare is about, reducing that inflammation and helping to reduce the symptoms of some of these conditions. Especially today, that's what our topic is really about, especially the hormonal side. So I think it's important to understand the whole science of, bacteria on the skin and how it affects the skin. And we're going to talk about that for a few slides. So if we think about our skin and our body kind of as one miraculous system that works together, it really is meant to protect the health of our bodies, the health of our skin, and to preserve our natural beauty. Because the skin is the second largest immune organ, I know many of us as licensed estheticians or medical professionals, we learned in school that the skin is the largest organ of the body, which is true, but it's the second largest immune organ, only second to the lymphatic system. And unfortunately, because it's so large and it really has systemically a lot to do with other organ function and balance that comes within the skin, it can become problematic very easily. Some of the things that can cause negative effects within our skin could be negative lifestyle choices. So smoking, let's say, or if we're happen to drink heavily, or we take certain drugs, and I'm talking about prescription drugs as well as probably recreational drugs. For some of us, lifestyle choices are not a choice. If we work outside and we're in the environment all the time, that can also have a negative effect on our skin. Where we live, if we happen to live in a valley like Los Angeles or Phoenix, Arizona, where there's a lot of pollution, or a large city like New York, that can have an influence on our skin. Hormonal imbalance, which is what we're going to discuss today. Prolonged stress. Stress is an amazing emotion, or effect, I should say. Not only can it have effect on us mentally, but physically as well as what we see in the skin. Chronic health issues. There are certain diseases and illnesses that can cause stress to the skin. Some of those we'll be talking about today. And our age, unfortunately, as we age, the proteins in our skin start to break down, things like collagen and elastin, glucosaminoglycans, and that causes aging to actually be premature in some people. So there's chronological aging, and of course there is environmental aging that we get from UVA, UVB rays. So by protecting and balancing the microbiome, which is that wonderful bacteria-rich protective barrier that we have on our skin, we can actually help to prevent and correct many of these skin issues. So when we talk about probiotics, because remember, that's really what Glowbiotics is all about. We were the first to put probiotics in our products, and it's not just in some of our products, it's in every one of our products. So how does probiotics really help with your health? Good probiotics, of course, in our gut, when we talk about gut health, play a role in recycling and metabolizing the hormones of our body. And these are the hormones that are naturally produced within our body. For example, our thyroid hormones, estrogen, as well as phytoestrogens. Conditions that are caused by hormonal imbalances can definitely affect the skin. And I think sometimes as practitioners, we only think of hormonal imbalance in the skin as either premature acne in young children when they're going through puberty, or as a hormonal fluctuation in women as we start to have estrogen depletion as we get older. But there are many more actually. Topical prebiotics, probiotics, and postbiotics can actually balance the symptoms from these hormonally induced skin conditions. So some conditions that, and we're going to talk about most of these today, PCOS, which is polycystic ovarian syndrome, thyroid conditions, estrogen depletion, pregnancy and post-pregnancy. So it can have a lot to do with when you're nursing as well, and then post-nursing when the hormones start to even fluctuate again, and then autoimmune disorders. So your health and skin disorders. Hormones are chemicals that are produced by glands in the endocrine system. Hormones travel through the blood system to tissues and to organs, and they deliver messages that tell the organs what to do and when to do it. Again, something that we don't think about. We think about it, hormones and how they can alter, oh gosh, our mood, how they alter certain functions within the body, how they alter our skin. But we don't think that they actually have a job and they actually have a function when it comes to the organs in our body. Because skin is the largest organ of the body and the second largest immune organ, when there is an imbalance with the hormones, the skin can be highly affected. So let's talk about some of these hormones before we move on, because there are 5 main hormones that we will find that actually can contribute to skin conditions. First, there's estrogen. When the production of the female sex hormone estrogen sees a drop, so when we have a drop in estrogen, it can cause your skin to sag, to lose its tautness, and this can in turn lead to wrinkles and fine lines. It can also lead to a lack of elasticity in our skin. Then we have testosterone. Testosterone, I know we think of mostly as a male sex hormone, but women also need testosterone in their bodies. When it is produced in excess, however, we can get an increase of sebum or oil in the skin, and this can lead to acne. This is actually what happens quite often as women go through menopause and they start to find that they are growing a little bit more hair on their face, excuse me, and as well their skin gets oily. Thyroid. When the body lacks in thyroid hormone, it can actually cause the skin to become overly dry, very pale in color, and it can be very sensitive and prone to damage. Sometimes those with thyroid disorders, well, whether it be hyperthyroid or hypothyroid, can actually find that they will get a little bit of thinning in the skin and have a difficulty with blood circulation as well. And this is why the skin can be prone to damage so easily. Then we have serotonin. If we considered both, which serotonin is actually considered both a neurotransmitter and a hormone. The right balance of serotonin gives us peaceful sleep, which we all want, boosts one's mood, and prevents premature aging. A lot of times for those of us who work out and exercise on a regular basis, serotonin is one of those mood elevation hormones, and people will say, you know, if you work out, you're going to stimulate a lot of serotonin, and this will, of course, in turn then give you a happier feeling. They'll tell people suffering with depression to really, you know, exercise to help level those serotonin levels. Really important right now, while many of us are sitting here and in a quarantine type of situation. And then we have cortisol. Cortisol is commonly known as the stress hormone. Cortisol is used to regulate the stress in the body, stress levels in the body. However, when levels of cortisol peak, it can break down muscle formation, and this leads to increased acne and impaired healing. A lot of times, if you, especially as you get a little bit older and you're going through hormonal changes like menopause and that, cortisol is one of those hormones that they say that if you have a lot of belly fat and you gain weight mostly in the middle, it's usually a cortisol deficiency. So what we're going to talk about today is several of those specific skin conditions that are caused by certain hormonal imbalance. We're going to talk also about globiotic products that can be paired together to help the condition. So we're going to start with PCOS, and this is polycystic ovarian syndrome. And I have found over the past few years, more and more women are getting diagnosed with this condition. And it's very interesting when you hear the statistics on this. PCOS is a hormonal disorder that's common in women of reproductive age. So it can affect anybody from a teenager to a woman who is perimenopausal. In fact, it affects 1 in 10 women of childbearing ages. It's caused by an imbalance of women's reproductive hormones, which then creates a problem in the ovaries as well as elsewhere. So a lot of times there's pain associated with this as well within the ovaries. The ovaries are the paired organs that create and store the eggs, of course, that is released monthly as part of a healthy menstrual cycle. In the case of PCOS, the egg may not develop as it should, or it may not be released during ovulation as it is supposed to be. Again, that's usually accompanied with pain in the ovary, and women will feel kind of a sharp stabbing pain with this type of a condition. Women with PCOS have high levels of androgens, and these are the hormones that are typically attributed to males, though women naturally have them too. These higher than normal levels can be preventing the ovaries from releasing an egg. They're also the hormones responsible for extra hair growth and acne, excessive oil, and premature signs of aging, all of which are symptoms of PCOS. So this is a tough condition. This is a condition that has a lot of symptoms with it, not only physically, but on your skin. So we're talking about, you know, if this does hit a woman who is teenage years, even in her 20s or 30s, yes, it can start at growing that vellus hair. They can get breakouts, and in more mature skin, it actually speeds up the aging process. And that's because we get a breakdown of, again, those proteins in the skin, collagen, elastin, and all of the things that kind of hold that matrix of the skin together and make it strong. So when we talk about PCOS and how to treat it, we have two products that I like to particularly recommend. Again, these are more treatment products. Of course, we want our patients or clients to use a cleanser and a sunscreen and an eye cream, of course, but I'm going to talk to you really about getting to the heart of the condition and attacking it. So with PCOS, reducing oil production and decreasing bacteria by using a unique peptide matrix with an antibacterial effect without causing normal inflammation found in OTC drugs, that's one thing that would be great if we could do that. And we can find that in our advanced retinol renewal treatment. This is a retinol that is definitely made for someone who either has used a retinol in the past or is ready definitely for some correction. This is a very corrective product. And these two products that I'm recommending to you now together actually will help to reduce that oil, and it will, again, with not only the retinol content in the advanced retinol, but with the peptides, it actually will not cause inflammation in the skin and overstimulate the skin. And that's what, remember, Globiotics is all about. We also, with the clarifying lotion, which is, again, a lotion that is a matte finish. It is oil-free. It is going to hydrate without drying out the skin, but it balances the skin. And that's what we need with PCOS. So we're going to absorb elevated levels of oil while providing a mattified look and feel to the skin. We're going to calm deeply in the skin painful acne with antiseptic ingredients and antimicrobial ingredients that are found in both of these products. We're going to create the appearance of a smaller pores and resurface the skin using that smart retinoid complex, which we have in our retinol renewal treatment. And the complex of key peptides that is in combination with that is again going to give you lower levels of irritation. This PCOS skincare will provide an amazing benefit for even the worst skin. So you're going to notice as we go through some of these specific skin conditions that are caused by specific health issues, that some of these pairings that I've put together may be the same for different conditions, but there's a reason for that. For this reason, with PCOS, the reason that we've chosen retinol is to combat not only the acne that may be showing on the skin and breakout, but to combat oiliness and even the signs of premature aging, because that's what retinol's for. And by putting the clarifying lotion in combination with the advanced retinol, we're getting a calming yet antibacteria again and hydration stimulation within the skin. So again, this is a great pairing for PCOS. Then we're going to move to estrogen depletion. So a bit different than PCOS. Now we're not talking so much as specific with reproductive organs. We're talking about full body estrogen depletion, which can affect the body as well as the skin in many different ways. So due to depletion in estrogen levels in the skin, peri- and postmenopausal women commonly experience a very specific set of skin conditions. These include dryness, decreased elasticity, and increased wrinkling. So you will notice as you start to get to the age where you are perimenopausal, so we're pre-full-blown menopause, you will start to notice a huge fluctuation in your skin. You may have been one of those oily skinned people your entire life. Well, now you start to notice that you're not as oily and you're a little drier. Maybe you need a little bit more moisture during the day or even at night. That elasticity, we're starting to get a little jowly, maybe losing that elasticity, and you'll notice those fine lines and wrinkles are becoming more prominent. The underlying deficiencies is really specific to reduced estrogen levels within the skin and a lack of collagen synthesis and a lack of cell proliferation and migration. and the reduced blood supply. So what happens is we actually have less circulation in the skin. This will slow down the exfoliation process that we have just on a regular basis. Naturally, it slows down that collagen synthesis and production of collagen, as well as elasticity. When estrogen levels decline, hormonal levels become imbalanced. The imbalance can also lead to some skin changes. A change in progesterone can increase skin dryness, which can leave the skin on your hands and feet cracking. So it's not just on the face, it is the entire body. I can tell you that personally, when I went through the menopausal stage, it was definitely a huge change on my entire body. My hair changed, my skin changed, but not just on my face. My hands and legs, my feet were much drier than they used to be. Testosterone is still produced at low levels after menopause. So, but too much testosterone can stimulate the oil gland and lead to breakouts, meaning you can even get pimples in menopause. And I would say probably, and I don't have the exact statistics, but I would say at least 85 to 90% of women going through menopause get the dry skin, but then they also get breakout along with it. And it's very frustrating because we have signs of aging and signs of dryness, yet we have signs of breakout like a teenager. So how do we treat the skin correctly? We need anti-aging products and something hydrating, yet we need something to control that underlying breakout that is happening. So for us, the answer would be at Globiotics, our Ultimate Youth Restoring Serum, and for a lotion, daytime hydration, our Probiotics Firming and Replenishing Lotion. So this powerful duo targets the loss of firmness and moisture and volume that occurs when estrogen depletion happens. These two products work together to help boost hydration levels and visibly plump the skin, build collagen and reduce fine lines and wrinkles by using a growth factor that actually mimics peptides. It's actually a growth factor mimicking peptide that actually is a proprietary formula that we use, along with a smart retinoid complex. So in our Youth Restoring Serum, this is our all-in-one. We call it our 3-in-1 serum. And this contains not only retinol, that smart retinoid complex, but it contains two proprietary peptides. One is a growth factor mimicking peptide. So we don't use growth factors in our skincare products, but this peptide that we have found actually mimics what a normal growth factor would do within our body and our skin, and it actually will stimulate then our own natural growth factor benefits. And then we have another smart peptide that actually helps retinol revert into retinoic acid within the skin. So we're really packing a punch here. We have that Youth Restoring Serum that has the retinol, the peptides, and then vitamin C. So for that patient or client that just wants one product, they're very difficult, right? They don't want 6 different products or 4 different products to use. They say to you, I want one serum that I can use and a moisturizer, right? Well, this would be it. This is that all-in-one serum, our Youth Restoring Serum. Now, along with the Probiotic Firming and Replenishing Lotion, which happens to be my personal favorite moisturizer, because it improves moisture levels of dehydration, and it balances lipid and oil depleted aging skin, yet it still stimulates collagen and boosts the skin's natural immunity and gives hydration to the skin. This really together, they bring balance to the skin with both the topical probiotics, all of those wonderful ingredients I just mentioned to you, and it really starts healing the skin from within. Again, remember, retinol is one of those ingredients that penetrates deeply into the skin, so we can say that this combination really helps to heal the skin from the inside out. Now, if you have that client who's a little bit drier and they need a little bit more moisture, what we can do is swap out the firming and replenishing lotion for a more moisture-rich cream. And in this case, what we would switch it out for would be the moisture-rich replenishing cream. So this is a probiotic-infused duo that reduces wrinkles and targets signs of aging, stimulates collagen production, brings skin's natural moistures back in balance. So again, we have that youth restoring serum, but just with a much richer cream for that drier skin type. Or we could sell them the youth restoring serum. They could use the replenishing lotion during the day, and for nighttime use, the moisture rich replenishing cream. So let's talk a little bit about pregnancy. Many of you on the line know that when your body goes through the world of change during pregnancy, some of the skin changes can actually be permanent. Most actually reverse themselves within weeks or even a year after giving birth. So, you know, there are women that have the most gorgeous, beautiful, perfectly balanced, healthy looking skin, and then they become pregnant and they end up with rosacea, or they end up with grade 3 or 4 acne, and they've never broken out before in their lives. So we also have the opposite, people who have breakout prone skin or sensitive skin, and they become pregnant and their skin is better than it's ever been. So a variety of things happen to your skin as hormones fluctuate during pregnancy. And it usually shows up, as I just said, in sensitivities, breakout, dryness and itching, sun sensitivity, rashes. Of course, some of us get the stretch marks, dark patches. Pigmentation is definitely part of this. Skin tags can become more prominent during pregnancy, and even varicose veins. Just remember that this can all be normal. What causes changes during pregnancy? Well, as we've been talking about, it's fluctuations in hormones, and that's generally the culprit here. Changes in estrogen and progesterone levels influence skin in all pregnant women. Hormones tell your pores to secrete oil, make you vulnerable to heat rash, and susceptible to skin discolorations. With your immune system suppressed and your blood vessels stretched to the max, perfect conditions for surface inflammation are created. So I think during pregnancy, we're even more susceptible to skin sensitivities and new skin symptoms and conditions. So we have several recommendations for pregnancy because there's a lot of different conditions that people suffer with. So first, we're going to talk about those who suffer with redness during pregnancy. So my duo that I've put together in recommendation for you is the Calming Restorative Treatment from Globiotics, as well as our Gentle Probiotic Calming Lotion. This is really the perfect duo, and I can tell you that during pregnancy, I have several people that I know that actually have switched all of their skincare over to this duo and had great success balancing their skin. This is also a great duo for those besides pregnancy that suffer with rosacea or redness prone skin. And I also like to use these two post-treatment. If I'm giving a peel or a microderm or a dermaplaning, this is the duo I recommend. So for pregnant and post-pregnant women who want to minimize redness on the skin, it's important to focus on the most effective and safe ingredients. This powerful yet soothing post-pregnancy skincare duo uses topical probiotics to reduce redness. By doing so, we can help calm the most sensitive skin types, reducing redness on the face, soothe, soften, and hydrate dry and irritated skin. We can strengthen the natural skin barrier function, reduce the appearance of redness in the skin for firming and tightening. And again, in these products, we actually have that growth factor mimicking peptide as well that we just talked about earlier. And we can alleviate discomfort to itchy, red, and dry skin. Now, what about the pregnant woman who suffers with acne during pregnancy? So we normally have to be very careful of what pregnant women use during pregnancy, but we actually make a 2% salicylic acne refining treatment and clarifying treatment that is completely safe to use during pregnancy. And then along with that, we have our gentle probiotic calming lotion again. So again, I'm going to add a little salicylic, which remember, salicylic, yes, we know it's great for breakout, but it's also a great anti-inflammatory. So, and then the gentle calming lotion, which we've already talked about in the last slide, to calm the skin. So higher levels of hormones during and after pregnancy can be caused by increased secretion of oil glands, clogged pores, and sebum buildup in the skin. This duo helps. So again, we're talking about reducing irritation and redness, bringing moisture levels back to the optimal level, unclogging the pores and exfoliating, and targeting and stopping the production of acne-forming bacteria. This helps to encourage the microscopic exfoliation and, again, balance the skin. So I also want to mention that the acne clarifying and refining treatment, the serum can be used in two ways. It can either be used as a spot treatment for just the breakout area, or if your client or patient is experiencing breakout all over the entire face or excessive sebum production, they could use the serum all over the entire face. Then we need to talk about pigment in pregnancy, because pigmentation is very tough, and we all have those clients that get pregnancy mask. And unfortunately, the melanocyte becomes very activated with hormone disruption. And when we have excessive hormone production, that melanocyte goes into overdrive. And what happens then is the melanocyte produces melanin, and we get brown patches, hyperpigmentation on the skin. So for this duo, what we've put together is advanced vitamin C brightening serum and our probiotic multi-brightening and anti-aging cream. So why have I chosen these two? First of all, our advanced vitamin C is an amazing vitamin C. I know every skincare line out there has vitamin C. But this is actually the first vitamin C in 30 years of being an esthetician, and that I can actually use a vitamin C without irritation. And it's really the fact that we have no fragrance. It's a completely clear product when you dispense it, has no fragrance in it. We didn't put anything in it to make it smell like oranges, like a lot of companies do. And it is a combination of both a lipid and a water soluble vitamin C. So we get great penetration without irritation. So common side effects of pregnancy can be increased dark spots, as we have just said, and we get what we call pregnancy mask. Now this probiotic infused duo targets the unwanted pigment, using ingredients that are safe during pregnancy. We do not formulate with any hydroquinone, and the brightening cocktails and lightening agents that we use are completely safe to use during pregnancy. Of course, vitamin C will brighten the complexion, and we use that dual complex, those two forms of vitamin C. We also have a multi-powered skin brightening lotion, which infuses the skin with reparative probiotics and antioxidants. And these products contain new lightening molecules that are safely inhibit the production of melanin, and that's what really causes this dark pigmentation. So really great that we actually get this wonderful duo that not only targets the pigment but helps to even the skin tone and also gives you a little bit of anti-aging benefit. So that takes us to our next condition, which is thyroid fluctuation. So this is a very, again, common condition. Many suffer with thyroid disorders. They're very common. In fact, about 12% of people will experience an abnormal thyroid fluctuation or function at some point during their lives. Women are 8 times more likely to develop thyroid disorders than men. Also, thyroid problems increase with age and may affect adults differently than it does in children. At the most basic level, thyroid hormone is responsible for coordinating energy, growth, and metabolism in your body. That's why oftentimes when you go to the doctor and they test for thyroid conditions, if you've had an unexpected sudden weight gain, if you have thyroid issues, or they sometimes notice that people will get a little bit larger through the neck and area. It's sometimes a sign of thyroid issues. Problems can occur when hormone levels are either too high or too low. Hypothyroidism, or low levels of thyroid hormone, show your metabolism and decrease growth or repair of many parts of the body, including your skin. And this is why sometimes when you're suffering, especially with hypothyroidism, you have a slower healing. So if you bump yourself and you get bruised, you may take longer to heal, or even if you cut yourself or have a wound. And then also during illness, it takes a longer time to heal as well. So thyroid fluctuation, I actually went back to our duo of the calming restorative treatment, that serum, as well as our calming lotion, which we've already discussed, because this really for thyroid fluctuation is going to be the best bet, especially because that hormonal imbalance with thyroid is usually accompanied by dryness and irritation, redness and itchiness. And this is really my duo that really best helps those symptoms in the skin. Now, hormonal acne. Probably pretty tough for most of us to treat. And this can be hormonally, whether we're talking about a teenager or we're talking about women fluctuating as we get older. So hormonal acne is triggered by changes in your hormone levels, particularly androgens and testosterone. Hormonal acne most often affects teenagers going through their hormonal changes of puberty, of course, pregnant women as well, and those going through menopause, though adult women with normal menstrual cycles may be susceptible to this too. In other words, when you start your menstrual cycle, usually about a week to 3-4 days before, you'll start to see a pimple, 1 or 2, you'll get a little breakout here and there. Other conditions that affect hormone levels can also trigger acne. A rise in androgen levels can trigger a chain of events involving more sebum production, changes in cell activity, inflammation, the colonization of hair follicles by bacteria known as P. acnes, which is what we all have learned it and call it. The immune system response to this is a form of inflammation, and together these can lead to acne. So it's very important for us to understand exactly where the sebaceous gland is located. And when we talk about sebum being produced, it can be produced, yes, naturally by hormonal fluctuation, but it can also be stimulated by injury. And inflammation is a form of injury, whether it be natural inflammation or let's say we do a dermaplaning on someone. Because remember, in the hair follicle, that's your pore. In that pore, the hair follicle goes very deep. Attached to that follicle is the sebaceous gland. So when hormone changes occur and we either get sometimes we'll get a fluctuation, we'll start growing that vellus hair a little bit more. Puberty hits, especially with boys, right? They start growing a beard, plus maybe sometimes they're involved in sports, the excessive sweating. All of this, or let's say as professionals, we're doing a dermaplaning. When that hair follicle is stimulated by an inflammatory trigger, we can actually stimulate the sebaceous gland to start producing more oil. Now, depending on the condition, whether it's a teenage boy who's playing sports, there's a lot of bacteria growing on that skin. That sebaceous gland can become the pore can then become plugged with the sebum from the sebaceous gland as well as the bacteria. Same as, it's a little bit different of course, but it's the same idea as we go through menopause. The sebum is produced, but unfortunately, at menopause, the difference is we normally have a little bit drier of skin. So what happens is we get the clogged pore then. The skin cannot release it up to the surface quite often. So sometimes in menopause, we'll get kind of those underground cysts and embedded comedones. And that is the difference between kind of younger hormonal acne and as we get older, menopausal acne. So for hormonal acne, we have a combination of our advanced retinol renewal and our probiotic firming and replenishing lotion. Now I put these two together for two reasons. First of all, acne and retinol really should be paired together always, because when you have breakout, the retinol will not only control the sebum, but it will help with microscopic exfoliation to get rid of all those dead skin cells, and it's antibacterial. So we're going to be fighting the P. acnes, we're going to be exfoliating, and we're going to help to balance. The probiotic firming and replenishing lotion, we talked about this one a little bit earlier with one of our other duos. This is the perfect lotion because it gives that anti-aging benefit, and it also gives a little bit of hydration and balancing to the skin. So if I had a teenager, with acne, I would definitely recommend the retinol renewal for nighttime, maybe 2 nights a week, 3 nights a week. I would have them spot treating maybe with our acne clarifying treatment, the 2% salicylic serum I mentioned earlier. And I would probably put them on our clarifying lotion because that's the oil-free one that gives a matte finish, and that's what teenagers are going to like. But for more mature hormonal breakout, again, let's do the retinol renewal because of the benefits of retinol, not only for the acne, but for more mature skin. It's going to have all of those wonderful anti-aging benefits as well. Collagen stimulation, anti-wrinkle effect, and then the probiotic firming and replenishing lotion. It's light enough that it will not cause more breakout, yet it's hydrating enough that it will help with the fine lines and wrinkles and gives a little bit of firming action also for that more mature skin. So one thing to remember is the importance of probiotics in the Globiotics products. So I talked about all of these individual duos today and the benefits of the key ingredients in them, but you also need to remember the benefit of the probiotic. And the whole idea of probiotics in skincare is to balance the microbiome. If we can balance the microflora of the skin, we can strengthen the skin, and this will protect us from environmental threats. We can enhance the skin's ability to become and stay properly hydrated. We can diminish factors that trigger sensitized and redness-prone skin. We visibly can improve signs of dryness, including tight, uncomfortable feel, and we can restore healthy pH balance to the surface. So probiotics will break down, or I should say, help diminish the inflammatory reaction happening in the skin and also restore the pH. And by balancing that pH, not only will we have less breakout, we will have less signs of premature aging and less redness and rosacea type prone reactions in the skin. So one other thing to remember about Globiotics is our no-no list, or some of you refer to it as a blacklist. We pledge to 100% committed to being safe and clean and effective. We are free of parabens, phthalates, sulfates, artificial dyes, synthetic fragrance, dioxane, ethylene oxide, propylene glycol, chemical sunscreens, mineral oil, formaldehydes. And I will tell you that the list has even grown since this slide was produced. So we are constantly looking at our products, making sure that we are creating our products with as clean as they can possibly be, with no toxic ingredients and no worries about there being any contraindications that would cause sensitivities or inflammatory responses in the skin. So before I give you all your discount code for joining me today, I wanted to mention to you, I know a lot of us are, again, had to close our businesses or our business has slowed severely with this pandemic that is occurring. I wanted to give you a couple helpful hints, and I've been using these slides on every webinar I've been doing this month. But just for those of you who are new and on the line, some ideas to stay in touch with your clients. I think it's important for your patients to know that even though you're out of sight, that they are not out of your they are still in your mind, excuse me. So don't become an out of sight, out of mind service provider. Stay in touch with your patients and clients. Send emails. If you do texting within your office or your facility to your clients or patients, send them a text. And it doesn't have to be trying to sell them something. Check in with them, see how they are, make sure they and their family are healthy and doing everything they can. Give some health tips. Say, are you getting outside? Are you exercising? Are you getting out into the fresh air? A lot of people are lonely. Some people live alone, and they happen to be, confined without their family around. So give them a call. Pick up the phone, say hello. Send them snail mail. What about sending a little thank you letter for being my client? I look forward to seeing you again when this is all over. It's so nice to get a letter in the mail, and rarely do you get a handwritten letter anymore. Offer incentives to your clients or patients when they return and when things return to normal. And that's important. We don't want them to forget about us. We want them to know that we are going to be there for them when this pandemic is over. So you may want to also consider, if you're tech savvy, virtual consults. Go on FaceTime with your clients, see how they're doing, talk to them. And, with all this stress that's going on now, a lot of people may be having skin conditions, breakout or dryness or redness. So have a virtual consultation with your client, and then you can make some recommendations for them. Also, a great idea is to plan an event for when you reopen. So make this like a grand reopening almost, right? Or a post-pandemic party or something. Come up with a clever little suggestion and theme. Also, in those emails and letters, suggest some overall health tips when you do your consultation. Some skin tips and tricks will be important, especially if their skin has changed during this time. Promote the benefits of probiotics and how they help to balance the skin microbiome. This is important, especially now. I mean, all we're doing right now is hand sanitizing and washing our hands. And I will tell you that hand sanitizer, we need it. It fights viruses, but we also sometimes, unfortunately, strip the good bacteria as well as the bad bacteria. So probiotics on top of using your hand sanitizer and your antibacterial soap will actually help to balance that skin microbiome as well. Also, I wanted to mention to you that we have a wonderful drop ship option. So for those of you who have had to close down and you stay in touch with your clients or your patients, we will actually drop ship directly to their home for you. And 50 orders of $50 or more, we charge no shipping to your clients or patients. So in other words, if your client needs some products and you don't want to ship it to them, or you can't get into your facility to ship it to them, let's say, you just give our customer service line a call and they will take the order from you and we'll drop ship it directly to your client for you. So I wanted to mention before we leave, we have a great April promotion, 25% off our Soothing Essentials Home Treatment Kit. Normally it's $112.50. You're going to get it this during April for $101.25. This is actually the perfect kit for your clients or patients to start out with by using it, especially for many of the conditions that we just talked about today. They're all full-size products. It comes in a beautiful bag. The only thing that's a small size is the brightening layering solution. So I do, before I give you that discount code, want to invite you all to follow us on social media. I can't believe how, with all this time on our hands, I've been watching social media blow up. I follow so many of our accounts and other, skinfluencers and things like that. And it's really interesting because a lot of us have more time on our hands. We're on Facebook, we're on Instagram, Twitter, Pinterest. Also, I wanted to let you know that all of the webinars I'm giving during the month of April are being recorded and they will be on our YouTube page. So we can give you the YouTube link and you can watch all of our webinars, especially for those of you who never get a chance to do some continuing education. These might be very helpful for you, and customer service can give you that link, as well as if you email me, I can give you that link too. So today for attending, and I know it says 5%, I'm sorry, I forgot to change it. It's actually a 10% discount. If you use the code WEB408, that's WEB 408, when you either email customer service or call our 1-800 number, you will get 10% off on any orders placed. So what does this mean to you for those of you who are closed and are not currently ordering wholesale orders? If you decide to continue to sell to your clients or patients, and you decide you would like us to drop ship for you, we will give you 10% off of anything you order. Now it's up to you whether you pass that savings on to your patients or clients, or if you want to just take the 10% off. And remember, that's 10% off wholesale. So to place any orders, contact customer service at cs@globiotics.com or dial our 800 number at 877-423-1314. So I'm going to leave up my screen here with all of our contact information, and I'm going to give you guys a chance to ask me any questions that you might have regarding the webinar, regarding specific skin conditions. I would be more than happy to take your questions. Also, I wanted to let you all know our founders, Christine and David Watson, will be doing an Instagram Live tomorrow. It's going to be an open forum. You can ask questions to them, and it will be at 11 a.m. Pacific time or 2 p.m. Eastern time. So that's our founders of Globiotics. And, you know, David and Christine both have a very long background in the industry. You might recognize David Watson's name from philosophy as well as biomedic. And Christine was a buyer for Harrods department store for many years in London. And both have had a very long, extensive career in skincare. So they are very knowledgeable, and again, the originators of probiotics in your skincare. So I'm going to give it a couple more seconds here. I see some people signing off, but if anyone has any questions, I'm here and you can go ahead and ask. Okay, it looks like, let's see here. It looks like I do not have any questions coming through right now. Oh, hold on one second. Do you need a password for YouTube? Well, it is a protected for the professionals only, so we do have a link. You can go to YouTube and look up Globiotics, and it might take you there, but we do have a special link. We kind of have it hidden so that it's for professionals only, but absolutely either email customer service for that link or go to YouTube and see if it'll bring it up for you. Also, I have another question. Do you recommend growth hormone injections to suppress hormone depletion? Boy, I'll tell you, that's a tough question. I mean, I have, you know, I work with several estheticians who are medical estheticians and work with endocrinologists, and you know, I've had a lot of people that have had success with injections, as well as the little pellets that are put underneath the skin. I think it's very dependent, and again, I'm a medical esthetician, so it's hard for me to really give a true recommendation on this. I can just give you my personal opinion. I think it has a lot to do with the individual person. I think it depends on the severity of the hormone depletion, where it's coming from, and I think growth hormones are one of those things that when you add them to the body artificially, we want them to stimulate the good growth hormone. We want them to stimulate good cell renewal and good cell repair. But are they also possibly stimulating something that we don't want stimulated or don't want growth to be stimulated? So I think it's very, very important that the right physician is consulted in hormone or growth hormone injection supplementation. Let's see, my email. My email is education@glowbiotics.com. Education@glowbiotics.com. Another question was, can I get a copy of your slides? We do not give out the full presentation, but you can rewatch this through our YouTube page. Now, if there are specific slides that you wanted regarding, you know, the condition itself, or wanted those recommendations of those duos that I made, go ahead and email me and I'll be happy to share, you know, some of those slides with you. That would be no problem. And again, my email is education@glowbiotics.com. You're welcome. Thank you for joining. I had somebody thank me for the class. You missed the special code. Yes, it is WEB 408. WEB 408. And that's the 10% off. And when you either email our customer service or call them at the 800 number, they will be able to give you that. Tell them that you were on the webinar today, and they will be able to extend that 10% off for you. All right, I want to thank everybody for joining me. My next webinar will be on April 13th, Monday. It will be at 3 p.m. again Eastern Time, 12 o'clock Pacific. And we will be discussing hyperpigmentation and how difficult it is to treat, and some ways to combat it. And we'll be talking about different ways that hyperpigmentation shows itself on our skin. So I hope you all can join me, and I really look forward to having you all on our webinar next Monday, the 13th. Take care, everybody.